We do believe that mentorship is key to building a resilient workforce and for retaining APPs. And it's really an investment in supporting APP development and helping create the environment and workforce that you want in the future.
That's Dr. Jennifer Gray with Levine Cancer Institute. You'll hear more from her later in the show. Welcome back to the award-winning Cancer Buzz. I'm your host, Summer Johnson. Today's show is a special edition created and sponsored by a handful of state oncology societies across the nation on a topic that's top of mind and will be educational for everyone. We're talking about supporting APPs, or advanced practice providers, from day one. Cancer care centers are building onboarding programs for APPs that focus on learning and retention. We'll explore unique models across practice settings, including in the academic, comprehensive, and community settings. We hope you listen on for tips and different approaches to onboarding and maximizing the role of APPs on your team.
We do have a very large APP team of over 50 APPs. And I think one of the most important things in onboarding APPs in a complicated academic medical center environment is that we have a very clear system and a clear structure to how we orient and onboard APPs. In addition to that, I think it's very important to not only focus on the new hire APP, but also their preceptors and making sure that both parties are very well supported during the orientation process.
Dr. Glen Peterson is a DNP and the Education and Quality Director at the University of Colorado Cancer Center. He says that in a large academic setting, providing structure to guide APPs through the complicated ins and outs of the academic care environment is essential to their integration.
But I think having that structure for both the new hire APP and their preceptors is very important. Having something they can rely on during the orientation process is very important. Another thing that I think is very important that we've learned over time is that focusing on the most basic things as the most important things is very important. You have to build that base for new APPs so that their subsequent learning is well supported by building that base. So I think when thinking about the most basic things, making sure that all new hire APPs are able to do those very basic things very well. So that includes performing good examinations on patients, an excellent review of systems, and an excellent physical exam, and then being able to present that information to the multidisciplinary team is extremely important. These really, I think, two things that are very key starters for any APP beginning in a new role on a new team. And then once they build that base, you can expand from there. If you don't build the base, APPs will struggle throughout their orientation and potentially beyond orientation.
When it comes to building that base, we asked Peterson what his team found to be the most effective to support both the APP and the preceptor in onboarding.
It's a good question. I think there are two main things that we do and that we find most effective. First is setting expectations and then doing check-ins. So making sure that the new APP knows what to expect during the orientation process. They understand the structure and the process of orientation. And then also that preceptors also understand what is expected of them during the orientation process of any new hire APP. So what we do at our institution is we have weekly check-ins with both APPs and preceptors to really go through any concerns, any problems they're having, provide feedback. The preceptee is also able to provide feedback on the process. And with this approach, we pick up on things or issues or concerns early, and we can intervene and we can, get things back on the right track if there are issues.
Peterson said they're able to identify any issues quickly as they track progress.
Yeah, so I would say that our check-ins serve the purpose for this in a lot of ways. So with each weekly check-in, we talk about how the preceptee is progressing, what needs they have, what extra support they need. But in addition to that, we have our preceptors and preceptees maintain a OneNote notebook that really keeps track of and really houses the structure of the orientation process. And with the use of this notebook, it allows them to stay on track with particular topics and particular clinical experiences. In addition, preceptors and preceptees can also provide and document feedback or areas to work on. They can also set up the structure for the upcoming week and make sure that they have a plan for how they're going to proceed during that particular week of orientation.
Finally, he said support is critical even after orientation, and here he outlines how that happens at the University of Colorado.
Once they come off of orientation, we don't just throw them to the wolves. Basically, we kind of slow roll them off orientation. So we give them a capped list of patients, and then meet with them week by week off of orientation to make sure they're doing okay, and then slowly increase the number of patients that they take and check in and just make sure that they're doing okay, that they still feel supported.
We know onboarding will look different in academic and community settings. So, how does a community cancer center provide structure early on in the process? We asked Jonathan Catrona, who's a physician assistant with New York Cancer and Blood Specialists. His practice designed something called the APP Academy, which trains APPs to become familiar with the wide range of symptoms and treatments they might encounter on the job.
What I always tell my new hires is I want you to have a foundation. You don't have to know everything. You don't need to know the fourth line of CLL. It's great if you know it, but for new hires, it's kind of useless. But you want to make sure that you have the foundation of a little bit of everything. And that is our goal. So the way we structured is every week has a goal. For example, the first 4 weeks we start up benign hematology, so I want them to get the foundations. You want to know what anemia is, you want to know what thrombocytopenia is, you want to know what neutropenia is. You want to start there and then move up from there. That is something that we've designed, and it's been pretty successful so far. We've had about 20, 25 people go through it, and it's been quite successful. And across our national network, we've had about, I think, over 60 go through it across the United States. So it's been pretty much a game changer for us.
Catrona began working with his team to build the program from the ground up 2 years ago. Before the program, the organization had a more casual onboarding process, which led to knowledge gaps in the curriculum.
We had something unofficial off the books. It basically was kind of like passed down from person to person. It's like, okay, we every weekday we pick a topic. Okay, let's pick CLL. Let's pick colon cancer. They would go over that for the week. So we never really had anything formally. So the way we designed it is we want to make sure that every week or two has something specific. So like the first 2 weeks is benign hematology. Then after that is introduction to chemotherapy. Talk about some of the side effects, what drugs can you can expect, and then we've spoken into breast cancer, to go into hormone positive, or HER2 positive, HER2 negative, different treatment options. Lumpectomy, mastectomy, going into is adjuvant radiation needed, and do the risk stratification scores to see if chemotherapy is needed, and the role of endocrine therapy. That would be, so all that for breast cancer would be 1 week. For example, our program in total is about 26 weeks. So and we have about 15 topics. Majority topics are 2 weeks. Some of them are 3.
He went on to give some of those examples of personalized curriculum.
For example, malignant hematology is a pretty big section. We go into, non-Hodgkin lymphoma, Hodgkin's lymphoma, multiple myeloma, amyloidosis, and the whole gauntlet. So that takes a while. So that's 3 weeks because it's a pretty big slide deck. And we want to make sure that everybody has enough time. One way that we try to do it is if if a new hire reaches out and says, I want more time, a specific topic, we do allow for more time. That is something that we try to incorporate, especially if they have, let's say, like, for example, we had some new hires who had recently came from lymphoma leukemia service as a nurse, and they knew that like the back of their hand. But they don't know much about solid tumors. So what we decided to do is we gave them more time in solid tumor and then less time in liquid tumor, less time in leukemia lymphoma, because they already knew that. They could probably even teach us. So that was something that the way we design if we try to personalize it to everyone. We do have a standard like 26-week curriculum, 6 months.
This new process provides APPs with a structured curriculum so that they have the information they need to make a seamless transition into their new workplace. But not all APPs are starting in the same spot. Often there are people in the same onboarding class that have varying levels of experience. Dr. Jennifer Gray is Assistant Director of Advanced Practice at the Levine Cancer Institute in Charlotte. She says her team uses a tiered system to handle onboarding of APPs with different backgrounds.
So for our organization, we basically have 3 tiers that we're looking at. So we're either hiring an APP that's a new graduate, or a second option would be an APP with experience but new to oncology, or third would be an APP who actually has some oncology experience. So we set things up a little bit differently depending on where the APP falls in that. So within that, we have flexible milestones and timelines for the APPs to meet during onboarding. We have regular assessments and check-ins with the preceptor as well as the supervising physician to measure where they are with meeting those milestones and timelines. And then we really rely on our preceptors and supervising physicians to use open, transparent communication and being upfront with the new APP about their progress toward the goals and creating a supportive environment for them to be able to reach those goals.
Gray specializes in clinical research and says that because the Institute holds many clinical trials, all of their APPs are required to go through specialized training. But for those who will be heavily involved in clinical research, orientation will include several additional components.
Number one, we actually have them spend some time with staff from the clinical trials office so that they can understand the perspective of the patient and the clinical trials office staff, meaning what does it look like to go through the informed consent process, the inclusion and exclusion criteria, the screening process, everything that's involved in even enrolling in the trial. We also have content to go over the CTC-AE criteria to be able to grade side effects for patients. We have content around looking at the protocol. Some protocols are 200 pages long, for example. So what are the parts of the typical protocol, how to find what you're looking for, specifically around things like prohibited medications and expected side effects. So there are several different didactic pieces that we go through. And then for people who are actually going to be covering our phase 1 clinical trials unit, where we treat many of our patients on early phase trials, there are precepted days that they spend with an APP who's already covering in that area. So they get the didactic pieces, but then they also get precepted clinical experiences.
Gray says support cannot just stop at the onboarding. Her center puts a big emphasis on mentorship.
So for APPs who have experience but new to the specialty, we start with an expectation of a 6-month mentorship program. And for new grad APPs, we have a 1-year mentorship program. For APPs who come in with oncology experience, most of them are not necessarily interested in mentorship, but we do consider that if they have an interest in mentoring. So, a big part of a successful mentorship program is looking at the mentor mentee pairing. We want to make sure that the mentor and mentee interests align and that they have compatible interests. We schedule regular check ins between the mentor and the mentee, and we do have some suggested topics to touch on. One of those being communication, another being managing conflict. We also get regular feedback from our mentees on what is working and what is not working. We like to measure, do they feel supported? Do they feel like the program is adding benefit? And then a big part of mentorship, honestly, is just acknowledging that oncology is a challenging specialty and acknowledging that there are going to be days that are going to be tough so that new hires can normalize feelings of grief or uncertainty on those tougher days that they have.
Gray says they also found their APPs really wanted to get involved in their organization.
Our APP Council is pretty exciting to me. We just started it up about a year ago, and we actually had a survey that went out to all APPs that clearly demonstrated we had frontline APPs who very much wanted to get more involved and have a say in a lot of different activities for our team. So, in looking at that feedback and thinking about what we could do to foster engagement, we created an APP council. We have 4 domains. We have APPs that are engaged in education, professional development, social activities, and then recognition of APPs.
As the patient population and the demand for trials grows, so does the need for APPs. Oncology care centers are reevaluating their programs in search of new ways to enhance care delivery. One thing that Peterson with University of Colorado says his program learned while examining where they could improve was to be more open in the hiring process.
I think historically, we didn't hire inexperienced APPs, whether that be an inexperienced nurse practitioner or PA. We just didn't hire inexperienced people. And I think we missed out on a lot of opportunities with really great providers. And I think at that time, we just didn't have a very solid structure to our orientation process. But since we've become, much more pointed at how we approach the orientation process and how structured we've created or how structured our process has become, we really feel at this point that if we hire good people, good colleagues, people that care about what they're doing, care about patients, we can really support them and really teach them all that they need to know to become a good provider on the blood cancer team. And so we feel that with our structure, with our process, really anybody can be successful as long as they have those attributes that we really look for in a teammate and a colleague and a provider. And again, if they have all those attributes, we can teach them the rest. The other big thing I think that I've learned over time is to just really stick to the basics up front. Stick to learning how to perform a good assessment, how to present a good presentation to the multidisciplinary team. And I think this approach, again, it builds that base. And then if they build that base, they can learn over time. But if you don't have that base, your APPs will suffer, and they'll struggle throughout the orientation process and the early part of their career. And also, I think if you stick to the basics up front, You take a lot of pressure off of APPs, new hire APPs, and their preceptor. You don't have to try to teach them too much all at once. You can just focus on those basic skills that they need to develop to build that base, and then you can teach them more later on.
When it came to designing the program at his community-based practice, Catrona learned that one of the most important things to do is to request feedback and to do it soon.
Because there were certain things about the program that I didn't necessarily was aware of, because you kind of put the blinders on. You're like, oh, this is great. Then you realize in reality, maybe it doesn't work. One of the things that we thought about is maybe giving presentation with PowerPoints, try to be academic. And for our standpoint, we see 15, 20 patients a day. We still have time. I mean, and that didn't work. So, I did that for the first 3 months and I quickly abandoned it because it's not conducive to learning. It's just more busy work. My goal is not busy work. My goal is to help you learn. I'm not giving you degrees. My goal is to make sure that you're able to help patients and help people. And the best way to do it would be to just do it informally and just say, can you give me an example like a colleague, especially like all of us in the field, we go to colleagues with questions, and especially if we have difficult cases, and that's the form we wanted.
Onboarding isn't where the learning ends. Gray says she likes to remind new hires that oncology care is always evolving, and her role is to support her colleagues.
I tell everybody that I have the best job ever. Like I said, I work clinically, primarily in clinical trials, and there's a lot of hope in that. It's really great to be kind of at the forefront of seeing what are the things that we're going to be able to do for patients in the future that are really going to be able to, have a positive impact not only on them, but their families and their outcomes. I also really love the administrative aspect of my job because it's great to think that you can contribute in a small way to helping the professional development of APPs and just trying to make things better for both APPs and for patients.
We want to thank our guests today. You can check out the show notes for links to resources on effective onboarding models for APPs. Today's episode was developed by the following oncology state societies: Empire State Hematology and Oncology Society, the Iowa Oncology Society, the Nevada Oncology Society, the North Carolina Oncology Association, the Rocky Mountain Oncology Society, and the Washington State Medical Oncology Society, organizations committed to advancing cancer care in their communities. We're grateful for their support in bringing this information to life. Until next time, for the Cancer Buzz team, this is Summer Johnson.